Hi, my name is Erin, and today I will be performing a head-to-toe assessment on my volunteer here. I did already obtain written consent, but I am just also going to get verbal consent before beginning. So is it okay if I perform this assessment on you today?
Yes.
Perfect. If you feel uncomfortable at any point, let me know and we'll stop. Okay. So I have already provided privacy for my patient. I did my hand hygiene off camera. I'm going to ask my patient for 2 patient identifiers, and then I'll jump into the head-to-toe assessment. So can you tell me your initials and your date of birth?
EM and May 6th, 2002.
Perfect. And do you know where you are right now?
The hospital.
Perfect. And how come you're here today?
So you can perform a physical assessment.
Perfect. And can you tell me the month and the year?
December 2020.
Perfect. So my patient is alert and oriented ×3. Her speech is clear and concise, and as of this point, she is appropriate. So we're gonna just start with the head to toe. I'll start with your head, and we'll literally work our way down. Okay. Just gonna jump over here. So first, I'm going to start with her head. I'm going to palpate your head. You just let me know if you feel any tenderness. Okay. Good. No pain or anything, right?
No.
Good. So she has a pretty even hair distribution. Her hair is thick and curly. I don't notice any dandruff or any lice or anything of that nature. I didn't feel any skull abnormalities, and there's no like lesions or anything of that nature. You don't have any problems with like hair loss or anything like that?
No.
Okay, perfect. Okay, so I am now going to move on to your eyes.
Okay.
On first inspection, your eyelashes and your eyebrows have good hair distribution. I don't see any edema noted around your eyes, no dark circles or anything like that. If you could just close your eyes, I'm just gonna lightly palpate just to see if there's any tenderness. Good. No pain or anything, right?
No.
Okay. And do you wear glasses?
I do not.
Do you have any trouble with your vision at all?
No.
No. Okay. All right. So I'm gonna take my pen light out, and I'm just going to shine the light in your eyes. I just want to make sure that your pupils are appropriately constricting. Okay. All right, so just look forward for me. All right, here's the first one. Perfect. And the second. Perfect. So her pupils are equal, round, and reactive. Her sclera is nice and white. I'm going to test for accommodation now. So I'm going to put my pen light out here. I just want you to follow the pen, okay, with your eyes only. Perfect. So her accommodation is intact. And then same thing, I'm going to keep my pen here. I want you to keep your head still. I'm going to move it. Just move your eyes, okay? Okay. Perfect. So again, my patient is able to track appropriately, and her eye assessment seems within normal limits. There's no eye drainage or lesions or anything of that nature on her eyes. So I'm going to move to your ears now. Okay. On first inspection, her ear looks completely normal. No tenderness or anything noted, right?
No.
Okay. So to the external ear, there is no drainage or any lesions. She does have 2 ear piercings, but they look like you've had them for a while because they're completely healed at this point. I'm just going to shine my pen light in your ear. Good. So the tympanic membrane is visible, and there's no like earwax or again any drainage in the inner ear. So that looks good. I'm going to just test your hearing. Okay. So I'm going to tell you 2 words on each side of your ear. You just repeat them back to me.
Okay.
Dog, ball.
Dog, ball.
Perfect. Cat, fluffy.
Cat, fluffy.
Perfect. So her hearing is intact. All right, so now we're going to move along to your nose. You don't wear any hearing aids or anything like that,
oh, no.
Correct? Okay, and you've always passed your hearing test at your physicals?
Yes.
Perfect. All right, so again, I'm gonna shine the pen light up your nose. Just look for any drainage or any nodules. Just tilt your head up a little bit for me. Good. Good. So her nose looks good, no drainage, no nodules. It looks completely normal. Next, we're gonna just test your sense of smell. Okay. So I'm gonna have you close your eyes. I'm gonna put 2 different smells in front of you,
Mm-hmm.
and I just want you to let me know what you're smelling.
Okay.
Okay, so we'll start with the first one.
That's cinnamon.
Perfect.
Lemons.
Yes, it's a lemon extract. Good job. So her sense of smell is also intact. All right, so I'm gonna come over and we're gonna do your mouth now.
Okay.
I'm gonna have you open your mouth for me. You can face forward. Perfect. Stick your tongue out. Good. So her mucous membranes are pink and moist, which means she's hydrated. Her lips look good. There's no crustiness or any cracks or anything of that nature. She has all of her teeth. You don't have any trouble chewing or swallowing, correct?
No.
Okay, perfect. And then how are your eating habits?
They're okay.
Do you tend to like eat small snacks throughout the day, or do you have big meals?
I'm a snacker.
Okay, and is it generally healthy, unhealthy?
Unhealthy,
Okay.
usually.
All right, so we would suggest adding in meals to your regimen and adding some healthy like fruits and vegetables with regular exercise. Probably a good idea.
Probably.
Okay, so if I was testing her gag reflex, I would have her stick her tongue out. I would put a tongue depressor at the back of her throat, and the expectation would be her oral muscles would constrict and we would hear a gagging noise. For the purposes of this exam, she is a young teenager and she's able to chew and swallow appropriately, so we're going to assume that her gag reflex is intact. I did skip over the portion where I palpate your lymph nodes and all of that, so I'm going to do that right now, if that's okay with you. First, we're going to do your sinuses, so I'm just going to press on your forehead. You let me know if there's any tenderness, and then we'll move to your lymph nodes, okay? All right. Good. Any pain?
No.
Okay, perfect. And I'm just going to feel for your lymph nodes. Good. And we're going to just go underneath your armpit a little bit. Good. Good. And no pain or anything like that?
No.
Okay, so I didn't feel any of her lymph nodes, which is good. That means none of them are swollen. You haven't been sick recently, have you?
No.
Okay, perfect. So that is within normal limits. So we're just going to do a little bit of like range of motion on your upper extremities, and then we'll move to your respiratory assessment. Okay. So I'm going to have you flex and extend your head, so up and down. Good. And then turn your head side to side for me, if you will. Perfect. No issues with your neck. You don't feel any tightness.
No.
It feels normal to you. Okay. I want you to put your arm out for me and bend your elbow and kind of move your shoulder around. Good. And that feels okay?
Yes.
All right. Can we do the same thing with the other side? Perfect. Good. And you've never had any like shoulder fractures or arm fractures or anything like that? Okay, perfect. All right. So I'm going to move along to the respiratory assessment. Okay. And then we'll work our way down.
Okay.
So I'm going to turn you to the side. Just going to move your hair. All right, so I am first going to just put my hands on your lower rib cage. I want you to take a nice, big, deep breath for me. Perfect. So her chest expansion is symmetrical. In a normal hospital setting, I would be assessing underneath of her hospital gown, but for purposes of this assessment, I am going to be palpating and auscultating and everything over her clothing. Her back looks normal, and her chest looks normal as well. There doesn't seem to be any like abnormalities or any bone disfiguration or anything like that. So I'm going to just take a quick listen to your lungs. All I need you to do is to take some nice deep breaths for me, okay? Okay. 2 more. Perfect. So I did hear a little bit of expiratory wheezing to her lower lung bases. I do know that you have a history of asthma, so is that pretty typical for you?
Yeah.
Okay. Do you have an inhaler at home that you use?
Yes, I do.
Okay. So I would suggest when you do go home to just use that a little bit. Do you feel like your chest is a little bit tight with inhalation?
A little bit.
Okay. Is there anything that triggers your asthma, like dust?
Yeah, dust usually.
Dog fur, anything like
Yes.
that? Okay. Were you cleaning at all today? Could that have
Yeah,
triggered?
earlier I was.
Okay. All right. So I'm assuming that the dust triggered her asthma a little bit today, which is why I hear the expiratory wheezing in her bases. Other than that, though, her lungs sound completely clear to auscultation. Her breathing is normal and non-labored, and you don't seem short of breath to me.
No.
Okay. And her lips are pink and there's no cyanosis, so we're going to assume that her oxygenation is pretty good as well. So I am just going to listen to your heart now, and then again we'll work our way down. Okay. All right, just going to take a quick listen. Good, and just one more down here. Perfect. So I hear S1 and S2. They sound very appropriate. There's no extra lung sounds noted, or any extra heart sounds, I mean. Sorry about that. You've never had any heart issues or heart surgeries or anything of that nature, and you don't have any high blood pressure or high cholesterol? No. Okay. Do you know if that runs in your family?
I'm not sure.
Okay. All right. Well, that would be something to ask your family when you get home, because that is pretty genetic. So just be on the lookout. You're still young, but still. Okay. I'm going to just have you put your arms out for me. So I'm just looking for edema here to go along with your cardiovascular assessment. It doesn't look like there's any edema noted. You don't feel like you're swollen or anything like that? Okay. All right. I'm just going to check her skin turgor really quickly. Just look for dehydration, and that returns quickly, so that's as expected. I'm just going to check the cap refill on her fingers. Good, and that's less than 3 seconds, so again, within normal limits. She's getting good blood flow to her peripheral extremities. Her skin is nice and warm, it's dry, there's no lesions noted. She does have a little bit of like seasonal dryness, but that's expected because it's December, so of course just use your regular lotion. I'm going to just check your feet and your legs for the capillary refill as well. So I'm just going to press on your toes. Good. Good. And you're able to feel me touching your feet?
Yes.
Okay, good. And again, there's no edema noted?
No.
Just going to check your legs really quickly.
They're really hairy, sorry.
Okay, so again, no edema. It does look like she has like a couple scrapes and bruises, but nothing too crazy. All right, so,
Oh no.
oh, shoot. Okay, sorry about that. The puppy just came and interrupted. Who knew there's puppies in the hospital these days? Okay, so we're just going to continue with her cardiovascular assessment. So again, obviously I can't see underneath her gown, but we're just going to assume that everything looks normal. I don't see any jugular vein distension. It feels like she has a good carotid pulse. I'm just going to feel for your radial pulse. Perfect. You also have femoral and popliteal pulses. I won't check those just because they're underneath your clothing, but I am going to check your tibial. Good. And your dorsalis pedis pulse. Perfect. So all of her pulses are about 2+ as expected. So we're going to just do some range of motion on your lower extremities because we already did your upper extremities. And I'll have you walk a little bit just to see how your gait is, okay? So if you could stand up for me, and if you could just bend down and touch your toes. Good, so she has good range of motion of her back and her hips. I'm gonna have you bring your knee up and out to the side. Good, and you can bring it down, and then same with the other one, to the side. Good, and no tenderness or anything, no discomfort. No. Okay, if you could walk forward for me towards the window. Good, and then turn. And then if you could actually walk back on your heels for me, that would be perfect. Awesome. You can sit down, and you don't use any like prosthetics or any assistive devices such as a cane or a walker?
No.
No. Okay, and you're pretty active otherwise?
Yeah.
Do you exercise regularly?
Yes.
For the most part?
Yeah.
Okay. Okay.
For the most part.
Don't we all? All right, and then no problems with your balance or anything like that? No recent falls? Okay, perfect. So again, that's as expected. She's a teenager, and so she does have a pretty steady gait. So we are going to do a really quick GI assessment. I'm just going to listen to your belly. I'll just palpate it a little bit for any tenderness, and then we'll keep it moving. Okay. All right. Just going to take a quick listen. Good, so she has positive bowel sounds to all 4 quadrants. They actually seem a little bit hyperactive, and it's probably just because you haven't eaten that much today. Do you remember when your last bowel movement was?
Last night.
Okay, and do you typically have one every day? Is that normal for you? Okay, and is it regular consistency, formed and brown?
Yeah.
You didn't notice any blood in your stool or
No.
anything of that nature? Okay, perfect. Like we said earlier, you said you have a good appetite, but you snack most of the day, so it is suggested that you do just incorporate healthier snack options, and then regular exercise as well. I'm just going to palpate your stomach really quickly. We would do in the hospital setting deep palpation, just to feel for like spleen and kidneys. Just for purposes of this assessment, I'm just going to do light palpation, so I don't injure my volunteer. And then we'll see what we're feeling. So I'm just going to press on your stomach a little bit. Good. Perfect. No pain or anything?
No.
Okay. So her abdomen, from what I can see, is flat. It's soft, non-tender. There's no distension noted, so everything is good on that aspect. I'm going to do a really quick neuro assessment. So I'm just going to grab this little guy. So we have a makeup brush. One end is soft, or we could say dull, and the other side is sharp. I'm going to have you close your eyes. I'm going to just put this on your skin in various locations. I want you to tell me which side of your body I'm on, where I am, and then if it's dull or sharp. Okay? So close your eyes for me. Perfect.
That's the left side of my face, and it's sharp.
Perfect.
It's the right side of my face, and it's sharp.
Good.
That's my left arm, and it's sharp. Again, my left arm, and it's also sharp.
Good.
That's my right arm, and it's dull. My right arm, and it's sharp.
Perfect.
That's my left leg, and it's sharp. My left foot, and it's dull. My right foot, and it's dull. Right leg, and it's sharp.
Perfect. All right. So I am just going to assess your strength now. I'm going to have you put your arms out for me. I'm going to, actually, we'll put you to the side a little bit, that way. Okay, perfect. I am going to push down on your arms. I want you to try to resist me, okay? Don't let me push your arms down. Good, and then same thing the other way. I'm gonna push up, you push down on me, okay? Perfect. All right, grab both of my hands and squeeze for me. Perfect. Okay, and then you can actually face forward for me. We're gonna do the same thing with your feet. So I'm going to put my hands on the bottom of your feet. I want you to press down like a gas pedal, okay? Perfect, and then pull up your feet up towards the ceiling. Perfect. So she has good strength to all of her extremities. So I just want to test your memory really quickly.
Mm-hmm.
Do you remember either of the words that I said to you when we were testing your hearing earlier?
Dog and ball.
Perfect. Okay, so this patient's memory is intact. I am remembering right now that I did forget to assess the tactile fremitus, and that just shows how much air and lung volume essentially you have. So I'm going to turn you to the side, and I'm just going to have you say 99 repeatedly, and I'll see if that is intact. Okay, you can start.
99.
Perfect.
99. 99.
Perfect. So the vibration is within normal limits, and it seems that her lungs have good expansion and volume. So that will conclude my head-to-toe assessment. I just want to thank my volunteer for offering your time today. Sorry that the dog came in the middle of the assessment and was not expecting that. Thank you so much.